And we got the good doctor with us right now, Dr. Kavanagh.
Good morning, Jack.
How are you this morning?
Very good.
Dr.
Good morning.
How are you this morning, sir?
Oh, very good, Jack. Thank you. Good morning.
Good morning. Did you have a good weekend?
I did, yes.
We have a colleague, I don't know if you know him or not, but he's a doctor, so I guess you guys probably, have secret handshake or something. Senator Rand Paul with us next hour. Anything you want me to ask him?
Well, at this point, just to ask him how he thinks we're doing on social distancing and opening of the economy. I think in Kentucky we need to wait for the scientists and that they should be taking the lead.
Okay, so how are we doing?
Well, right now I think a lot of the states are doing well. I am very worried about Georgia. I think opening up the bars and restaurants and bowling alleys is just really asking for it. Some of the states, as you know, have opened the beaches and golf courses, and that I'm a little uneasy with the new guidance from last week that the sunlight tends to zap the virus. Possibly that's going to be okay with good social distancing. We're just going to have to wait and see. As many have said, this is like a big experiment. We've never done this before, so some of it we'll just have to cross our fingers. The good news is that yesterday the death rates appear to have fallen. Believe me, they are still terribly, terribly high, but much better than what they were before. And if that continues, that will be a good news. And so we need to wait to see if this social distancing will allow this death rate to continue to fall, or, God forbid, if we get a second bump. We just have to wait and kind of pray on that one.
Second bump is exactly what happened in, 1918 in the Spanish flu outbreak after everybody went back out?
Well, it did.
Round 2 came and killed more people?
Yes, it did. But now that happened in the fall, not the summer. And there is some credence to the theory that things are going to die down, not necessarily go away. Remember, the virus has jumped to the southern hemisphere, but die down during the summer. I really hope it does. In August, I'd like to see my daughter getting married with a small group of people instead of through iPads. And so that is, really important. And so that's something I hope happens. But I do agree with most of the scientists that we are probably looking at the virus coming back in the fall. But by that time, hopefully we'll be much, much more prepared for this, both with PPE and with better testing and more testing. And I think the testing is good to reemphasize that people need to remember these tests were developed in the course of weeks, not months and years. Many of them aren't thoroughly tested, and they will have false positive and false negative rates. So that if you get a result back, you need to really put that in context of how you're doing and what's happened and talk to your doctor before making decisions. Please do that. So overall, I think things are looking a little bit better this week.
Well, I think that's great news, and I don't want to take anything away from all of that. But did you watch SNL over the weekend, Dr. Kavanagh, and see that Brad Pitt got to play Dr. Fauci?
Yes.
In the sketch?
Yes.
Is that funny?
Yes.
Yeah. So it made me think, if you end up in an SNL sketch, who's going to play you?
Oh, I would like Jack too. I think he knows me the most.
And we look a lot alike.
And we look a lot alike, yeah.
Right. Here's a text from our Auto Tech Service text line. Please ask the good doctor why Tennessee is doing better with the numbers and businesses are open. Who is correct? First of all, are they doing better?
Well, I can check that right now. My opinion is that they weren't, but Kentucky right now has 47 deaths, and Tennessee has, well, it's getting too long to look at it. My impression is the last time I looked at it, it wasn't. I think that may be a phenomenon of how many tests that you're actually doing. So the more tests you do or the more tests you have available, the more cases you're going to find. And once you find more cases, then your number of patients that have died becomes less. So it's really difficult to compare between states. And I do know that Tennessee, at least I've heard on the news media from some of their leaders, have just abundant testing. So I think that they will be looking at probably having less of a death rate. But Tennessee right now has 1,453 people per 1 million getting infected. And Kentucky has, here we go, we have 918 cases per million. So we're lower, but I think Tennessee's doing more testing. So it's hard to tell. We do have slightly more deaths, but then it's really getting into our nursing homes. And it's really not, I don't think social distancing, but the nursing homes is being a problem that's starting to surface in Kentucky. Sorry about the statistics. It's hard to do Monday morning.
Is there any news over the weekend regarding hydroxychloroquine?
The news has been the same. I have seen no good news regarding hydroxychloroquine. All the studies that have been coming back, although they're still, you can say, preliminary, somewhat small or retrospective, they haven't been showing positive effects. All of them have been showing significant heart problems in a large portion of people. And large, I mean, if you use the hydroxychloroquine at kind of lower standard doses, it's about 8-9%. Higher doses, it gets up from that. So it's a dangerous drug. It's not one I would be choosing. The only treatment so far which has been shown, which really has been working, has been the serum treatments or the treatments of getting antibodies from other people that have been infected.
Good. All right. Good enough. Well, thank you, sir. We'll talk to you again on Wednesday.
Okay. Thank you very much, Jack. Appreciate it, sir. Thank you.